The ACT Education and Training Directorate and the Royal Life Saving Society ACT have developed this DVD to outline the steps schools are required to take to complete the Survival Challenge, a swimming proficiency test for students. The students are required to complete all 5 swimming proficiency tasks to be deemed proficient. If at any stage the student appears apprehensive, distressed or concerned, they should be removed from the activity and a yellow wristband applied to indicate they are non-proficient swimmers. The slide-in entry. The slide-in entry is a safe and controlled form of entry into both known and unknown depths. It allows the student to orientate themselves to the depth and temperature of the water. The student sits on the edge of the pool with their feet in the water. Unassisted, the student places their hands to the side of their body on the edge of the pool, then turns around so they are hanging over the edge of the pool before lowering themselves into the water, feeling for the bottom with their feet. The student should not drop into the water as they need to feel for the bottom in a controlled manner. The balanced walk. A student's ability to walk in water and maintain balance is important to their safety. Their ability to stand up from a swimming position is one of the first skills that introductory swimmers are taught. It is very different to walking and standing on land. The student turns away from the edge of the pool and walks in a balanced and controlled manner for 5 meters with their eyes open. Continuous swimming. Proficient swimming of 25 metres enables a student to reach a position of safety from any point within a 50-metre pool. Each student should confidently complete 25 metres using a stroke or technique that maintains a forward momentum. Remember, this is not a learn to swim program. Students should possess a swimming ability that allows for appropriate safe movement through the water. Body position should be horizontal and feet should not touch the bottom or the sides of the pool at any time. Students should be in full control of their breathing at all times. If at any stage the student is not demonstrating an action that is making progress through the water, they need to be removed from the water and have a yellow wristband applied. Any student that stops and stands up should also be given a yellow wristband. Always use the lane close to the edge of the pool because this allows for rapid intervention if the student gets into difficulties. Supervising school staff members should have immediate access to a suitable rescue device, such as a rescue tube or a reach pole. The survival sequence. The survival sequence identifies the student's ability to keep their head above the waterline so that they can call for help. The time frame of 1 minute is based on the simulated response times for lifeguards to recognise a swimmer in distress and perform an appropriate rescue. During the survival sequence, students should be able to keep their face clear of the water. Exit the pool. A student should be able to swim to the side of the pool and hold on to the edge. The student should then demonstrate that they are capable of either climbing over the edge or moving along the pool side to an appropriate exit point, for example, a ladder, ramp, or the stairs. Note that not all students will be able to climb over the edge of the pool. Nevertheless, students must be able to remove themselves from the pool unassisted. Students must show the ability to recognise their own capabilities and select appropriate exit strategies. The whole sequence of activities. There are a number of methods that can be used for conducting the Survival Challenge activities. Some methods to test activities within the Survival Challenge include several teachers positioning themselves to supervise the separate testing components. Students can then progress continuously through to the next testing activity after a successful demonstration. or they are removed from the pool and given a yellow wristband if they are not able to perform the activity competently. Blue wristbands would be applied to all those students who successfully complete all of the testing activities. Or, one teacher is responsible for assessing and recording the competencies of all students within one class. This method would still require additional teachers for overall supervision. Wristbands would be applied after all testing is complete. Whichever method is chosen, schools must ensure records are kept of all students' results. Classifying students' wristbands. Upon successful completion of the Swimming Proficiency Challenge, students will be issued with a blue wristband. Students who did not complete the challenge successfully will be issued with a yellow wristband. Teacher supervision. Teachers should be clearly identified by either wearing colourful shirts or hats. They should position themselves to provide effective supervision free of visual obstructions. Voice rescue. Voice rescues are the safest form of rescue and provide reassurance to a distressed individual. When attempting to rescue a person in difficulty, the rescuer should follow a priority sequence that begins with calling out instructions to the person. Instructions are called out to the person firstly to reassure them and then to provide suggestions on skills that they can use to get back to safety. The rescuer must alert an adult that assistance is required, maintain eye contact with the person in difficulty, provide reassurance and call instructions to help them get back to the edge of the pool.
I'll get 3 and then I'll get